Hello, my name is Letitia Greenwood, and today I will be speaking on female sexual interest and arousal disorders. Have you ever wondered why you or someone you may know has a decreased interest in sexual activities? Today we will look over females specifically with a low sex drive, commonly known as female sexual interest or arousal disorder. A woman can show interest in sexual activities but not get aroused or maintain arousal, meaning that they can actively participate but they're not into it, or they're experiencing some type of decrease into that sex drive to where they have no interest in what is going on at all. In some sexual situations, or in all sexual situations, one can have no interest in sexual activities at all, which is also known as hypoactive disorder. Different situations can be the cause of female sexual disorders. So it varies from a woman can experience this after giving birth to a child, whether she's experiencing a serious illness. Sometimes a woman's vaginal lining, which can cause pain during sex, can be the reason. Different emotions, different past experiences, current experiences someone is going through, stress, depression, relationships. All of those can be many reasons of why a woman's sexual decrease has came into play. And I did find this on the Mayo Clinic. Also, as seen on WebMD.com, no specific age can experience female sexual dysfunction. So you can have a woman as young as 21 to a woman as old as 80 who may experience some form of a sexual disorder, ranging from a low sex drive to no sex drive at all during or after sexual activities. Also, during the menopause stage, a woman will see no sex drive at all. They will not think about it. They have no interest in it. They won't talk about it or anything like that. I also seen on WebMD that a hysterectomy can also be the cause of a low sex drive or no sexual interest at all. Also, I was wondering, does drugs play a factor into a female sexual disorder? But surprisingly, I found that drugs do not play a factor. Well, no street drugs or hard drugs. But medications can play a huge factor in a sexual dysfunction. So different medications can cause stress, depression. It can cause a woman to not be there completely, like she's in the process of any sexual activity, but she's not into it. She's not interested in it. Like she has other things going on. So it's very important to discuss your medications with your provider to see if maybe the medications can be altered, or if that's a true cause of just the female sexual disorder. The side effects can differ person to person. When I say different from person to person, just depending on where a person's current state of mind is. So depending on what someone's currently going through, what someone has experienced in the past, any symptoms, any signs, or anything like that differs from person to person. So depending on what your experience will be, the side effects that you will more than likely see. So during the treatment plan stage, it's very important to tell your provider any past experiences, also any current experiences, any symptoms you're currently experiencing, currently or in the past, and any other important information. So it's very important to explain what you're going through, what you see, what you're feeling. Maybe it could have been a past situation that you've been through as a child, as an adult, but it's very important to include all that information in the treatment process, or even if you're taking medications, let your provider know. With that, it's very important to get the proper treatment, because one can either you can either get proper diagnosis from your provider, or if they're unable to treat you properly, they're able to refer you out, if necessary, to a therapist. I do know, I've seen on WebIndeed that they do have sex therapies available, which is very interesting, to get more help. Currently, there is no true treatment for the female sexual arousal disorder. Also, like I explained previously, treatment will differ from person to person depending on a person's long-term goals, relationship status, currently what they're going through in life. So I know a basic natural treatment for all is practicing self-care, watch what you eat, maybe open up to more people around you, find someone that you can express what you're going through. You're able to communicate with somebody else. Also, therapy is a big help. But prior to therapy, you'll probably want to do a natural way of treating yourself to see if you're able to overcome your issues yourself. If not, it's always good to reach out to someone. Once again, your OBGYN will be able to help diagnose your issues, or a therapist in general. Lastly, sexual dysfunction does not only occur in women, but you can see this happen in men and women. Specifically, the female sexual interest in arousal disorder does occur in women. Like I explained, anyone from the ages of 21 to 80. It's no specific outline or guideline as to why someone is going through this, what stage they're in, or anything like this. Everybody experiences some sort of sexual dysfunction disorder within their lifetime, whether it be something small or something major. But it is very important to get help, know your resources, utilize your resources, watch what you do, watch what you eat, communicate more, and never feel as to you're abandoning yourself or your partner. Just get yourself better, try all resources, and communicate your problems with someone who's able to help. So my references that I did use today was WebIndeed.com, OneHealth.com, and also the Comer and Comer book. Thank you. Have a great day.